Hi, we're here with Kathy. This is Dr. Myers from Fresh Start Bariatrics, and Kathy has been kind enough to share with us her story. Kathy, you were a diabetic before your operation, is that
Yes.
right?
Type 2.
Type 2 diabetic, and tell us what kind of medicines you were on during that time.
I was on metformin and I had been on Actos and
Lantus?
well, they moved me to Lantus because all of the pills that I was taking were affecting my liver.
Okay,
So I had to go off of those onto the insulin.
okay. How much Lantus were you on?
I was on 38 units.
Okay, all right. And before we go any further, tell us a little bit about the little one that you're holding in your lap.
She is number 52. We've taken care
That's a lot of
52
children.
foster-
You've gone through a lot of pregnancies.
Yeah, right.
Oh.
No, foster children. We've had 52 in 10 years.
Uh-huh, great. Well, tell us when you had your operation and which operation you chose to have.
I had the Roux-en-Y gastric bypass on November the 30th.
And you had that done using the robot, is that correct?
Yes.
Because I
Yes.
started before that time, so that's good. And what was your course like afterwards? How long were you in the hospital and all of that?
I did 2 nights,
Uh-huh.
and then everything seemed to be going well. I had a little bit of a stricture. You went in and fixed that.
Mm-hmm.
Since then, things have been going great. Been able to eat, keep everything down.
Mm-hmm.
No issues. I feel awesome. I was taking 20 medications a day
Wow.
before surgery. I now take 1. I take my thyroid medicine, and of course my Prevacid and my vitamin and my calcium. That's it.
So that means you don't take any diabetic medications now. What was
Right.
your sugar this morning or recently?
107.
So that's a big
And
difference.
No
That's wonderful.
medications for that. And my blood pressure is in control. My triglycerides are in control. Everything is coming down into the normal zone.
That's great. That's wonderful. And you said something about having a stricture. So about a month after your operation, you were having difficulty getting things down because.
Yeah.
And what was that like? I mean, tell us a little bit about that.
That was a little tough. I mean, things were going down and sitting in my esophagus because they couldn't get through because when it healed, it closed too much.
And how did we just tell them how we fixed that problem and how you felt afterwards?
I came into the hospital. You went down with a scope, put a little balloon, opened it up. There was no pain afterwards, and I was able to keep everything down, and it was so much better.
Yeah, I can imagine. I can imagine. And you've done very well. You've already lost how much weight?
Almost 50 pounds, like
Yeah.
48 pounds.
Yeah, and that's just been in 3 months. So
Yeah.
congratulations on your result.
I
And
feel much better. Thank you.
you're very welcome. My privilege, and thank you for sharing your story with
Oh,
us.
you're welcome.